Good afternoon, everyone, and thank you for being here. With me today, as you can see, is Dr. Alex Biu. Along with myself, he'll be available to answer your questions. Before we turn to COVID today, I did want to start on the weather. There is the possibility of 2 named storms in the Gulf of Mexico by next week. Our team at GOSEP is obviously monitoring these systems. We encourage all of you to do likewise. Tropical Depression 13 is moving very quickly. It's expected to enter the easternmost Gulf of Mexico early next week. Currently, it is forecasted to become a hurricane prior to landfall. Obviously, we don't know where that landfall will be, but anytime you have a storm that's going to enter the Gulf and is forecasted to be a hurricane, we need to all pay attention. Tropical Depression 14 is moving westward toward the Yucatan Peninsula by late Saturday before moving towards the northwest Gulf of Mexico by early next week. It is forecasted to become a tropical storm presently. And the most recent cone that I saw for Tropical Depression 14 does include portions of coastal Louisiana, basically from central portion of our coast on westward. Beginning tomorrow, GOSEP will start coordinating with OEP leaders in the coastal regions of our state. Obviously, I wish I could tell you more about what we can expect from these systems, but quite frankly, we don't know. But what we do know is it is possible that next week, 2, not 1, but 2 very serious storms could make landfall in Louisiana. And so that means if you haven't done so, now is an excellent time to get prepared for yourself and for your family. And before the end of the weekend, I'm encouraging you to check your emergency supplies. Keep in mind any potential needs that you may have that are related to the pandemic and you wouldn't ordinarily have. Think about what you would need to do for your family if a hurricane impacted your area and you had to get by the first couple of days without any assistance. Want to make sure that you pay attention to local elected officials, to the weather, that you monitor the situation, look for updates on the news and so forth. And it goes without saying, but I'm going to say it anyway, go to getagameplan.org if you haven't done so. Getagameplan.org. It will tell you what you need to do to be prepared for yourself and your family. And it has been updated to provide additional guidance because of the COVID-19 pandemic. So obviously we've been tested before. We're going to be tested again in many ways. Could come next week in the form of 1 or 2 storms. So please prepare yourself. Obviously, as I always do, ask you to also lift our state, our country up in prayer that these things wouldn't happen here. Now, moving on to today's COVID update, we are reporting 1,304 new cases on 14,060 new tests. Based on the number of tests that we have conducted in the month of August, we believe that by the end of the month, we're going to get somewhere between 500 and 600,000 tests. So 2.5 to 3 times the monthly goal that we have, and as you all know, that's a minimum monthly goal that we have. And I do want to thank everybody who's associated with this testing effort because it is a Herculean effort. It just literally doesn't stop. It is 7 days a week, and it involves everybody from the National Guard to our hospitals and our clinics and you name it. And having more testing allows us to know more about what COVID is like in Louisiana and what it's doing. And presently, the testing has allowed us to determine that as of the August the 14th, our statewide positivity rate is 8.77%, which is better than it has been for quite some time. You know that you want to, at a minimum, be below 10%. And we got to that level several days ago and moved into the yellow status for positivity, even though we remain in the red status for new cases developing over the 7 days, meaning more than 100 per 100,000 population. So we'll take that reduced positivity, because that is another indication that we are moving in the right direction. And I can tell you that we have 4 of the state's 9 regions that are testing below 10%, and we have the remaining 5 regions that are testing above, but all of those are actually below 12%. So what I'm saying is we're seeing improvement as a state, but we're also seeing improvement in every region of the state, and so that's very encouraging. But I do want to remind everybody that our gains have been relatively modest, and certainly they are fragile, and they can be lost. And one of the things that you always worry about is people being more mobile. And you remember we had all of those studies being done during the stay-at-home order about who was really staying at home in the state or around the country and so forth. Well, this month, in the month of August, we've got K through 12 schools that are reopening, and we have our higher education institutions are reopening their campuses. So as a result of that, we're going to see more mobility, more people coming into contact with one another than we have seen probably since early March. And so that's always something to be concerned about, and that's also why it's incredibly important, more important than ever, that people follow all the restrictions and mitigation measures that are in place that allow those activities to happen safely. And we do encourage parents to pay attention, close attention to their children's health, especially if they're doing in-person classes, if they're going to be present, because we have, I think I was told 39 of our school districts are open today. Another one's going to be open tomorrow for 40 out of our 69 school districts. None of our districts are open for all in-person instruction. We have several that are virtual only. The rest are in a hybrid, so that some of their students are present and some are not. And so that allows those schools to achieve the physical distancing that they need in order to be able to open safely. So it's incredibly important we do that. But just like we ask for people to stay home when you're sick, because schools have been closed, we're conditioned to believing that that applies to people who should stay home rather than go to work. It also applies to school kids who should not go to school if they are sick. Getting back to the day's numbers, sadly we are reporting 28 additional deaths. We're just shy of 4,500 now at 4,496. Today's numbers do include the first death in Tensall Parish. Probably the best news from today's numbers is that we have 1,087 patients currently hospitalized with COVID-19 across the state of Louisiana. 178 of them are on ventilators. Now, with respect to the hospitalized patients, this is a nice drop. And these decreases have been relatively consistent and sustained. I think we've had one day in the last couple of weeks where we actually inched up a little bit. But this is the biggest drop we've seen in quite some time. And what we know is if you go back to July the 27th, when we had 1,600 patients hospitalized with COVID-19, had we spent the next 3 weeks on the same trajectory we had been on the 3 weeks before we got to that 1,600, today we would have more than 1,000 more people hospitalized in the state than we currently do. And that's a function of the work that Louisianans are doing everywhere to follow the mitigation measures, to include the mask mandate, the bar closures for on-premises consumption, and the reduced crowd size for social gatherings, and that we put in place while we remained in phase 2. So there are signs that the numbers are working in terms of coming down. The mitigation measures, I should say, are working. The numbers are coming down. That's good news. Some of you may have seen the results of a study that Oxner did in conjunction with numerous partners, some at the Pennington Biomedical Research, and they did this study in conjunction with the Health Equity Task Force that actually provided some funding, and some funding that came from the Baton Rouge Area Foundation, the Wilson Foundation, and others. But in a 5-parish area here in the capital region, focused around Baton Rouge, 2,100 adults were tested between July 15th and July 31st. Of those 2,100 people, they were tested simultaneously both for the virus and for antibodies. And what the results showed that was most surprising to me was that 60% of those who tested positive for the virus were asymptomatic. Now, we've seen studies and estimates that range from 25% to 40%. But here in Baton Rouge at that time, the percent was 60%. That makes for a very challenging situation because asymptomatic people are much less likely to be tested. They're not going to know that they have it. And that is why it is incredibly important that everybody, regardless of whether they're feeling ill or have been tested or whatever, that they engage in these measures of wearing a mask, make sure that you're social distancing, make sure you stay home with your sick, cut down on your activity, make sure that you're washing your hands frequently, because this is what it means. If you take that percentage of people who were asymptomatic but positive and extrapolate it to the 5-parish area, there were 10,000 people within 5 parishes who were asymptomatic but yet carrying the virus, carrying the disease, and contagious, meaning they're also spreading it. That's what makes this particular pandemic so very difficult to manage. And that's why it's also important that we follow the data, apply the science, make sure that we are implementing those recommended mitigation measures that are designed to keep people safe out of the hospital and out of the graveyard. It really is that simple. Another standout from the study was that the symptom that had the strongest correlation with positivity was anosmia, which I didn't know what that was either. That's the loss of the sense of taste and smell. So of all the symptoms that have been associated with COVID-19, that was the one that had the strongest correlation to those testing positive. I want to also update you that yesterday I sent a letter to FEMA requesting an increase in the cost share of federal assistance provided to the state for this public health emergency. As we've been responding to COVID-19, we now have exceeded the threshold monetary cost that allows us to move from a 75-25 match to a 90-10 match. It does have to be approved by the president. That approval has to be requested. We've done that. And you should know that it is the FEMA funding that comes from the Disaster Relief Fund that's going to allow us to pay some enhanced unemployment benefits that actually allowed us to go over that threshold. So we put in that request to the president. We should know some more soon, and hopefully he will grant that request. Obviously, we would much rather bear the 10% cost share that is provided for in the Stafford Act than a 25% cost share. I also want to remind business owners that we want to help you to navigate the implementation of safe practices during this time. So please visit opensafely.la.gov and read the entire document to understand how it pertains to your business type. There is a lot of information there about spacing, crowd management, sanitation practices, the requirement to wear a mask and to ask customers to wear a mask and those sorts of things. We have to work through these issues together, but I can tell you the Fire Marshal's office under Butch Browning's leadership has done a tremendous amount of work. That information is there, and I do encourage business owners to go there, and not just your traditional business owners, but there's information there for churches and other organizations as well. That's at opensafely.la.gov. So we've got a lot going on, 2 storms and a virus. We've got unemployment assistance to get out. We've got opportunity to improve the amount we have to pay on the cost share. You name it, a lot of stuff going on. We do plan to have our next press conference on Tuesday at 2:30, but obviously with those storm systems out there, that may change. If that does change, we will certainly let you know. So I'll remind you, I've got Dr. Bu here today to help answer your questions, and now it would be time to ask them. Sam.
Governor, can you talk about the LSU reverse course yesterday and started reporting positive test results? Can you talk about what your administration is advising universities, when it comes to test results and what exactly they should be reporting and when and how and that sort of thing?
Yeah, so yesterday there was actually a meeting yesterday afternoon with Dr. Bu, I believe, and Kim Hunter-Reid, who is the Commissioner of Higher Education, but all of the system presidents. And I'm going to ask Kim to come up and go through that meeting and the information that was disseminated. My instruction to the Department of Health and to higher education is to make sure that we are as transparent and as timely as we can be with the accurate reporting of data. And we do believe that the information pertaining to these institutions of higher ed should be reported by those institutions. We will be interested in getting those numbers. We're going to aggregate them and so forth. But we really believe that reporting, the granular reporting, should come from the institutions themselves. But I was not in the meeting yesterday. Dr. Bu was, and he needs to earn his pay, so I'm going to ask him to come up and talk about this.
Thank you. So one thing I'll note is the decision by LSU or any other university before that meeting really wasn't with input from us. That was their own decision. So defer a question on that to them. As the governor noted, from the Department of Health standpoint, our biggest interest is, as with any setting, understanding where our cases and if there is a pattern or a risk that we're seeing cases linked, that we're intervening as early as possible to protect more people from being exposed to cases. So the information that we're looking for is really about on-campus students. It's going to be a challenge for us to handle them in the same way that we would say, a place of business where you're talking about maybe a single building or office floors on a campus. You've got both on-campus and off-campus living. You've got sprawling buildings and a variety of places that could be, linked to outbreaks. So what we focused on was talking about understanding the cases that are developing associated with on-campus students, and that's where we're going to be focused, certainly in our reporting. We do, though, want to have information from the universities in aggregate about what they're finding as far as number of cases. At any time, they have lots of virtual students. At this time in particular, many universities are emphasizing off-campus education, off-campus virtual classes, and so there's theoretically the possibility that an LSU student is, living at home with their parents in Lafayette and unfortunately develops COVID as a result of community spread there. That obviously is different to us than somebody who's living on campus in downtown Baton Rouge who's found to be a case. And so we had a really good conversation about how we're going to share data. We're still working out some of the details on the system that would support that, but that was the nature of our conversation.
Like where outbreaks on campus are happening, so you can send health officials and help them intervene? Is that what I'm hearing?
Well, so keep in mind, all of this is happening in the context as well of contact tracing. So any positive result will still trigger a contact tracing outreach where we will be ourselves gathering that information. We may find out through a contact tracing call that an individual is an LSU student or any other university student and is on campus. And so you could imagine there's bidirectional sharing. They may have data, because many universities are doing their own attempts to manage contact tracing that they share with us, and we may have information that we share with them based on what we learned through those conversations. So it's not a single process. What we want to do is maintain the very good relationship that we've had up to this point in bidirectional data sharing, so that at the end of the day, as quickly as possible, we're identifying anything that could present a risk to other students or to the public. Please.
Senator Cassidy tested positive for COVID, and he said that he knew because he took a rapid test. Can you just explain the importance of the availability of rapid testing?
Okay, so I won't speak about anybody's specific
Yeah.
health case because I don't know the details. So, I think rapid tests we've talked about before are a really important part of our armamentarium when it comes to testing for COVID. Rapid testing is really great because it's usually deployable in a variety of settings. It's a little bit easier to get out into the state. You get an answer really quickly. Depending on the test, that can be anywhere from 15 minutes, sometimes even less. But that it comes with some limitations as well. One of the big ones is that you usually have rapid tests being one at a time. And then the other being that usually the test, because of the nature of how it's run, may not be as sensitive, meaning it may not pick up as many true positives. It may have some false negatives. And in some cases, it may actually, because of the just user dynamics, it may give a wrong result, where we saw Governor DeWine have a positive rapid test result that when they did a laboratory-based PCR test, they found that was negative. So that doesn't mean it's not something that should be used. It means it should be used in the right context, and it gives us some useful information. But often with rapid tests, depending on how high risk an individual is, we recommend some sort of follow-up test as well.
Also on testing, I know LSU said today they have what seem to be kind of like these federal surge sites we have in Baton Rouge, but on campus. Can you talk about if I don't know if you're recommending or coordinating with universities about what this testing could look like, and also are there any of these federal sites where people can just go and get a test regardless of whether they have symptoms in Louisiana right now?
So there's a couple questions in there. So one, just in general, just like we've been working with the universities and other entities across the state on their plans for reopening, we've been talking with universities for quite some time about their testing strategies as they were thinking about the things they needed in place to bring students back in the fall. We continue to adhere to largely CDC guidance, which says you really want to test people who have symptoms or have reasons to be tested, maybe an exposure to a known case, first and foremost, rather than, say, doing a population-wide test. But we know that universities may also want to do some surveillance, test a certain subset of their populations to have a sense of, is there spread going on campus, and then intervene earlier. So we've been working through that with a variety of universities, not just LSU and Southern, but the U of L system and others who have reached out with interest to answer any questions that we can as sort of testing subject matter experts, and to give them sort of our policy recommendations. Ultimately, what they deploy is up to them. And there's all sorts of complexities about whether the testing is being done in a diagnostic capacity or in more of a surveillance capacity as far as how it's being paid for. To your question about federal testing sites, so we actually have surge sites across the New Orleans area. I think there's going to be 2 additional ones that open up tomorrow as well. And so those are for anybody to come and be tested. Currently, all of our community-based testing sites are still accepting individuals who want to be tested. We don't have a policy in place that would turn somebody away, to my knowledge, unless that site on the day that you go has run out of test kits, which usually shouldn't happen because we have a fair bit of those specimen collection kits. So both the federal sites that are active as well as the normal community-based testing sites that we do with the National Guard and the support of the Governor's Office of Homeland Security and Emergency Preparedness are open to the public.
Talking about higher ed testing, but on the K through 12 level, will there eventually be a uniform and universal reporting procedure for all 68 school districts?
So that's a complex question. From our standpoint, we want to make sure that we are, again, as transparent as possible about what we know about cases associated with different settings, and that includes universities and higher institutions of higher education, as well as K through 12 schools. The reason that it's a complex question is that when you start talking about, especially K through 12 schools, you've got both private and public schools, and then you've also got information about people who may be absent from school that schools are going to have that we may not have. And then we'll have information about people who actually have test results. So ultimately, is similar to what we talked about with the universities. We think that the best source of truth on any given day on what that school is experiencing is going to be that school. That being said, just like we are collecting data on any test that's positive, we do want to support those schools and have that bi-directional communication, like I mentioned, with universities. Whereas we learn about a student, we want to make sure that they know that that student, who might have been in one of their classes, was tested positive, and vice versa. The earlier that we have that communication, the more transparent it is between us as two entities, the earlier that we can intervene and avoid things like school closures, which none of us want to have happen, but certainly is a risk if you have spread that's happening without us being able to share that information.
Is there a minimum amount of information you expect from these school districts, like positive cases, like just the bare minimum, you've got to tell us X, Y, and Z?
Well, so all positive cases are mandatorily reportable to the Department of Health, regardless of whether that's a school child or anybody else. So that is a bare minimum. What we're working on right now with the Department of Education is really how do we build that information flow bidirectionally so that they too may want to know. They don't want to have to wait to find out, hey, we had a student that tested positive. If we have information that they don't, we want to share that with them so that they can make decisions and communications about other people in the classroom, parents, and so forth. But they know that dynamic. They know their communities better than we do. We want to make sure that they've already been communicating with parents as school has been restarting. We want them to continue to doing that great communication with parents. All right. Thank you.
Thank you. Thank you, Dr. B. Any further questions? Yes, sir.
Governor, do you have a date at which the $300 additional unemployment payments are going to start flowing here in Louisiana?
No, other than next week and as soon as possible.
You got the money from FEMA yet?
Yes, in fact, that was reported to me today by FEMA at the UCG meeting, that the first $375 million has been transferred. We are updating our system to make sure that it properly identifies everybody who is eligible for the enhanced $300 a week payments, and those payments will go out starting next week. And my instructions to the Workforce Commission was absolutely as soon as possible. And so I can commit to next week. What I want to believe is they'll start early next week. Yes, sir.
Governor, this afternoon, last night, today, more SEC schools releasing guidance. I know on Tuesday you told us, as far as capacity, I know you told us last night you hadn't received any plans from schools yet. You expected, in LSU's case, to get that sometime this week. For how long they needed to get a plan in place for September 26th. 48 hours later, have you received any plans yet?
Yeah, well, first of all, I had a very good meeting yesterday morning. I lose track of time. So it was early, 8 o'clock yesterday morning. I had a very good Zoom meeting with officials at LSU in the athletic department. And we had a very good discussion. I'm not going to say that I received a plan that they said we would like you to approve or disapprove or tell us what we have to change. But they told me all the things that they are thinking about, all of the CDC guidelines that they are implementing and what that looks like on campus on game day and so forth. And so it was really to get me up to speed on where they are in their planning. But with the first home game being September the 26th, when we're going to beat the Mississippi State Bulldogs, that plan would actually have to be approved, they think 2.5 to 3 weeks before that, in order for them to be able to implement it. So there's a little time left for them to refine a proposal and get it to me, but I do expect that that's going to happen over the next 10 days or so. But it's not anything where I can tell you today a plan has been approved and this is exactly what game day is going to look like.
So to clarify, 2 to 3 weeks out from September 26th
Yes.
is when you expect to have an announcement?
Yes. I think that there will probably be a decision made in the next 10, 12 days, something like that, an announcement shortly thereafter. And I do want to, and this is true not just for college football, this is true for everything that we do in the state of Louisiana. Any decision that you make in early September as for what's going to be in place on September the 26th is a preliminary tentative decision, because every day you continue to get new data. And you make a decision on what the data is like on that day and where you think you're going to be whenever it's time for that plan to be implemented. But you make refinements based on additional data that comes in, and so I just want to caution people that if you hear something at the very beginning of September of exactly what it's going to look like on LSU's campus or anywhere else for any other activity at a date that is 3 weeks removed from the announcement, understand that that is always subject to change. And so that's what makes this so difficult. And that's why I spend so much time up here telling you I can't tell you what I'm going to decide next week, because it's not next week yet. Look, I want to thank you all for continuing to cover this very important and serious public health emergency. And I want to thank the people of Louisiana, too, for the hard work that they have done over and over again now. You know, I announced when we had that second surge and it was so pronounced, and we moved up to having the most cases per capita in the country, that we had done what was necessary once before to flatten the curve and slow the spread, and that we would do it again, but it was going to look different, and it's going to take more time, and our gains are going to be slower. But what we're seeing right now is the fulfillment of that. And if we will just continue, we're going to continue to have success. And if we will have more people to buy in on these mitigation measures and have a higher percentage of our people who wear those masks, who make sure they're socially distancing from people not in their own household, who wash their hands frequently, stay home when they're sick, reduce their activity, then we're going to continue to be successful. And it is more important for us now to double down on all the mitigation measures that we know work, all the restrictions that we know work, because we are introducing a certain element of unknown because of the schools reopening and our universities reopening. So for all of those reasons, it is more important than ever. I urge everybody to please do your part. I also urge everyone to pay attention to those weather systems, and let's lift one another up in prayer. I pray that I don't see you till 2:30 on Tuesday, because if I see you before then, it means one of those weather systems has taken aim at us. So we'll see you next week. Thank you.